What is the high-level meeting on HIV/AIDS? The high-level meeting on AIDS is when all member states come together to review global progress made in reducing the impact of HIV since the last United Nations General Assembly high-level meeting on HIV/AIDS in 2016. The high-level meeting comes at a historic moment for the AIDS response. 40 years since the emergence of the first cases of HIV and 25 years since the inception of UN AIDS. The HLM on HIV/AIDS will be held on the 6th to 8th of June 2021. The UN General Assembly expects to adopt a new political declaration that will set the direction for the future HIV response. So why should people who use drugs engage? The HLM on HIV/AIDS meeting is important for people who use drugs, particularly people who inject drugs. It's important for us to engage in, not only because the world is nowhere near where it needs to be in terms of HIV, with HIV rates amongst people who inject drugs barely budging or actually increasing in some regions, but because the HIV movement has opened up political space to push for the issues that we want spotlighted. It is because of the HIV movement that was too loud to ignore that harm reduction became part of public conversation, that the interconnections between decriminalisation and health could no longer be denied, and that the power of community leadership was made indisputable. We are now in a world where that space needs to be protected more than ever. And the HLM is an opportunity for us as a global community of people who use drugs to defend and advance our priorities. The International Network of People Who Use Drugs want the 2021 political declaration to reference key populations by name, that is gay and bisexual men, people who use drugs, prisoners, sex workers and transgender people, so that we are no longer made invisible. The political declaration must affirm the critical importance of decriminalisation of drug use, sex work, sexual orientation and gender identity, and commit member states towards working towards the 2025 social enabler targets that include a 90% target on decriminalising drug use. Finally, the targets on community-led responses, that is, that 80% of prevention services and 30% of treatment services be delivered by peers. This is a way to make sure that the work of peers is safeguarded and fully resourced and politically supported. So how can people who use drugs engage? This is the time to advocate and have our community's demands heard. Find out who is the government official leading your country delegation in the HLM and write a letter demanding that they send the highest level of representative on the official country delegation, alongside people living with HIV and people who use drugs. Offer to meet with them and offer your support in the negotiations. Work with advocates and other community-led organisations to develop a position paper or document that you can use to influence your government's position. Engage in global advocacy campaigns to raise awareness of issues and communities' demands by using the hashtag #WeAreHLM and Pressure On. GNP Plus and AIDS Funds have developed a social media toolkit that can support online advocacy for community and civil society organisations. Use your voice to speak out about injustice, discrimination, and oppressive systems in your country that undermine the HIV response.